Turns pan machine on, located on the left side of machine. Press the R to reset. Places barriers on bite block and head stabilizers and control panel with sanitized hands. Logs into Dentrix and pulls up patient chart. Has patient remove all metallic and removable objects in the head and neck region.
Thank you.
Chooses the pan man. Single clicks on the flatbed scanner. Upper right hand corner.
Waiting for exposure.
Screen should say waiting for exposure. Explains the procedure. Verbalize. Stand still entire time. Machine will rotate around head. Relax and do not hold breath. Places the lead apron with Velcro on back.
You want to make sure your Velcro is not super overlapped. It's just perfectly set there together, and it's up and stable on the back, on the shoulders.
Sets the size. Child, youth, woman, woman, man, hefty person of the patient. Automatically sets exposure based on size. Display should read P1. Ask patient to stand as tall as possible with back straight. Adjust the height of the machine by pressing the up and down arrows on the control panel.
And you can have the patient step forward just a little bit, but not totally in the machine to set this.
Has patient cross arms and hold handles for balance. Has patient bite their anterior teeth into the grooves of the bite block and close their lips. Select the button to illuminate red laser lines. Sets Frankfurt plane using the slide on the machine. Lines up with targus of ear. Sets mid-sagittal plane. Lines up with centrals or center of nose. Adjust by instructing patient to move right or left.
So to review, the tragus would be right underneath the orbit, right near the Frankfurt plane would be right below the orbit near the tragus, and then the mid-sagittal goes right down the middle of their nose. If the mid-sagittal needs to be adjusted, the patient would turn their head to the left or to the right.
Closes the head stabilizers by pressing the correct button.
This one's for the forehead. You explain to your patient, these are going to touch your head just to hold your head stable during the procedure. They should just touch your head. You should not feel any pressure.
Instructs patient to stay still, close lips on bite block, swallow and place tongue to roof of mouth for entire procedure.
And just a reminder that the machine will go around your head, so you'll stay really still. I'm going to go out and shut the door, and after the procedure's over, I'll come in and you can step out of the machine. The x-ray machine will not work unless you totally close the door. It's a safety feature that we have here at Wake Tech.
While watching through the window, student presses the exposure button until the exposure is complete. Student enters the room and asks patient to step out of machine. ensures with faculty or DDS that pan is diagnostic, removes and hangs lead apron.
And you can put that in the trash. Sometimes the patient, when they stop biting on the bite block, the barrier will come off, and you can just ask them to throw it in the trash can.
Gives patient anything they removed and escorts them out.
All right, thank you. You did great. See you next time.
Pushes the R button to reset the machine. Removes barriers, disinfects unit and work area wearing gloves. Only wipe surfaces that were barrierized if barrier falls.
You definitely want to make sure that you wipe the metal part here where the patient was holding the metal part for stabilization, and then anything else that you touch that is contaminated.